Hey everyone, welcome back. Ready for another deep dive?
Always.
Today we're looking at something that could really make a difference in people's lives, a seven-step care management program.
Interesting. Tell me more.
It's all laid out in this document from Marti Health, and the focus is on patients with sickle cell disease.
Okay, so we're talking about a program specifically designed to support people with a sickle cell and help them manage their condition.
Exactly. We're going to break down each of these seven steps, and I think you'll be surprised by how much thought has gone into this.
Well, let's jump in. What's the first step all about?
Step one is called understanding the whole you. It's about getting a complete picture of the patient's health.
So it's not just about their sickle cell.
Right. It's also about their mental health,
Hmm.
how well they can handle their everyday activities, the whole picture.
I see. So it's about understanding the individual patient as a whole person.
Yeah. And to do that, they use some specific tools and assessments like questionnaires.
Questionnaires like to measure pain levels or something.
Exactly. Or to see how far a patient can walk comfortably, that kind of thing.
Makes sense. The more information you have, the better you can tailor the care plan to the individual, right?
Absolutely. Okay, so step two is called finding the missing pieces.
Sounds intriguing. What are those missing pieces?
Well, it's about finding any gaps in the care the patient is getting. It could be misappointments, trouble with medications, maybe even problems outside of healthcare.
You mean like social factors?
Mm.
Things like not having stable housing or enough food.
Exactly. These things can have a big impact on someone's health, even if they aren't directly medical problems.
It's also connected.
Then we move on to step three, connecting the dots. This one's all about making sure the patient has access to all the right resources.
Ah, so coordinating care. Making sure they see the right specialists, get connected to support groups, that sort of thing.
Exactly. And it's also about helping them navigate things like insurance.
I can imagine that can be a real challenge for some folks.
Absolutely. And this is where technology comes in. Step four is staying ahead of the curve, using AI to monitor patients.
AI, huh? That's pretty high tech.
It is. They use AI to predict potential health crises before they even happen.
So like an early warning system.
You got it. The AI can analyze vital signs, lab results, even just the symptoms the patient reports, and spot subtle changes.
Wow, that's impressive. Early intervention is so important for sickle cell.
Absolutely. Now, step five is the bridge back home, and it focuses on what happens after a patient leaves the hospital.
Ah, that transition period can be tough. So what do they do?
Well, the care team checks in with the patient regularly, helps them manage medications, and addresses any new issues that come up.
So they're not just sending patients home and forgetting about them.
Not at all. It's about making sure the recovery goes smoothly.
That makes a lot of sense. Preventing those readmissions. What's next?
Step six is called learning from every experience. They use data and insights from the patient's journey to make the program better.
Oh, so they're always trying to improve. I like that. How does it work?
They analyze what happened during any unplanned hospital visits, any health crises, and try to figure out the root causes.
So they're looking for patterns and trying to figure out how to prevent those same problems from happening again.
Exactly. It's about constantly learning and refining the care plan.
Sounds like a smart approach.
It is. And finally, we have step seven, always getting better, which focuses on the big picture.
So it's about using what they've learned to improve care, not just for this patient, but for everyone with sickle cell,
You got it.
right?
They share their findings with others to help improve care on a larger scale.
That's fantastic. This program sounds like it could really be a game changer.
It really does. It could mean fewer hospital visits, fewer crises, and a better quality of life overall for people with sickle cell disease.
It's amazing to see how much thought and care has gone into designing this program. You know, what I find really compelling is this emphasis on personalized care and continuous improvement. It makes me wonder, could this type of program be a model for managing other chronic illnesses too?
That's a great question and one worth pondering. It's definitely something to think about, right?
Absolutely. The potential impact could be huge.
Thanks for joining me on this deep dive. It's fascinating stuff, isn't it?
Definitely. Until next time.